For behavioral health AI platform, privacy and security are paramount due to the sensitive nature of the data we actually deal with, right? So, when we're talking about mandatory requirements, it really depends on the maturity level of the organization you're in and the risk tolerance, at the time. So, the bare minimum changes depending on your risk tolerance. As far as if we start with the bare minimum, we're talking HIPAA compliance. You can't go anywhere further without it. You want to have encryption at rest, encryption in transit. You want good access control to be in place. Role-based access control is preferred. But then as you move along, you want to look for compliance and audit capabilities. Can you really audit what's going on within the environment? Then you start looking at data minimization. Are you only providing information that's really necessary to complete the task? Are you anonymizing the data that you're providing to the AI tool so that you're not giving it anything that perhaps if the data is breached is going to come back to your client, right? So these are some of the mitigation techniques you can use by making sure that as you start, even just training the model, that you're providing data that is anonymized and you're only providing data that's necessary for the task at hand. And then, of course, you want to know if this data is ever being used is ever shared with other third parties. I think that's really critical. Those are some of the main components that we look at when we look at AI partners.